Dr. Yilmaz, thank you so much for participating in my show for the Serbian National TV. It's called First Class, and definitely you belong to this title. Thank you so much again. You helped more than 800 patients with Parkinson's disease, with movement disorders.
Thank you so much. It's really great pleasure for me and great honor for me to be part of this beautiful and great show. Thank you so much for inviting me. It's a really great pleasure to be in Belgrade, in Serbia. It's really great pleasure for me. Yeah, I'm a stereotactic functional neurosurgeon. I'm graduated from my medicine faculty 25 years ago. But last 15 years I'm doing almost only deep brain stimulation surgery. And I'm the president of the Middle Eastern and whole Africa continent, the Stereotactic Functional Neurosurgery Society, and the board member of the World Society, European Society, Southeast European Society, and International Neuromodulation Society. So far, I treated more than 800 patients from 56 countries from all around of the world. It's like I'm falling in love with deep brain stimulation surgery. I like to do that. I like to touch the people's life. And I learned this technique in Florida University, in Shands Hospital and the University Hospital of the Florida. Now I'm training to share my knowledge with the whole around of the world. I started this surgery in 8 different countries, first time, the deep brain stimulation surgery. And from 30 countries, the physicians came to my center to learn this surgery. You know, the Parkinson's disease is so difficult disease. It's not affecting only the patient's life. It's affecting the relatives of the patient's life too.
Whole family.
Yeah, everybody needs to take care about the patients. Now they are gaining their mobility again, their freedom again. They are happy. They bring me a letter presents. I'm so happy. This is the most funny times of the day to see.
Can you tell us a little bit of details about deep brain stimulation?
We are doing the deep brain stimulation surgery for Parkinson's disease, for dystonia, and for essential tremor. You know, all of these diseases, neurological diseases, and the problem, there are some abnormal signals inside the brain. We are putting 2 electrodes inside the brain, and then we are connecting these electrodes to the battery with extension cables. Everything is under the skin, nothing over the skin. And then we are programming the battery to send an very low electrical signals to the brain to solve these abnormal signals, to suppress these abnormal signals, to stop the shaking, to resolve the stiffness.
Impressive, really. This is something what medicine can do today. Can you tell me something about artificial intelligence? Do you use it in your practice, diagnosis, preparing treatments for the patients?
Newly, a lot of papers started to publish about using the artificial intelligence, especially on the making the diagnosis according to MRI, and to make the diagnosis earlier. Because the early diagnosis is so important to start immediately the medications, and then when it's needed to do the surgery, of course. And additionally, the AI is helping us to improve the targeting, the electrodes in the brain.
So it can be more precise for the patients, personalized for the patients.
Exactly. You know, the implanting the electrodes is so important because we need to put the electrode exact the necessary position. The target can be affect very high level the result of the surgery. So we need to find the best target. Because of that, I'm doing the surgery away. I'm putting several electrodes and testing each of them separately to find which one is best effective to release the hand, to stop the shaking. And the software, which supported by AI, is helping us to calculate this target.
And what would you tell about previous experience for the patients? Would you like to maybe tell us about some specific case, specific person that you helped and maybe you didn't expect that results of DBS in your treatment too?
Yeah, I remember 13 years old with dystonia. He had several very severe dystonic movements, and the whole life of the child was on the ground, He is shaking and moving involuntarily, and we did the surgery only to suppress these involuntary movements. But after 3 years, family sent his video when he's walking.
What do you think, what fields of medicine will be maybe irrelevant after a couple of years, or maybe after a decade? Or what fields will be irreplaceable in the future?
Actually, what the future will bring us with DBS, unfortunately, we are not curing the disease. We are just suppressing the symptoms to improve the patient's quality of life without symptoms, but we are not curing. In near future, we will have a chance to cure it, I think. And additionally, now, when you look from the DBS window, from DBS perspective, the brain-computer interface things will give us an opportunity to help the people paraplegic walk with their robotic legs, or without arm, use a robotic arm to drink by their thinking. The future is really amazing, and they are saying in next 10 or 15 years, they will be able to put our mind inside the artificial reality. The primitive era of this BCI is DBS, because we are implanting the electrode, but they are implanting several electrodes, very tiny electrodes, to not stimulate, to bring the information from the brain to the computer.
So, doctor, is that the thing that everybody will be smart in the future?
Yeah, and we will not need to use our arms or our legs. We can drive our car by our mind. Maybe we will need to drive. We will not need to drive in the future.
Okay, future is great and future is near. I would say thank you so much.